Welcome to Integrity Linguistics Institute.
So first, let's start by looking at a typical hospital admission for an inpatient, and the first communication they have about any procedures they are to undergo. On arrival, a patient will complete necessary paperwork. Various staff will talk to them about their treatment during their stay, which is designed to reduce patient anxiety. However, from some patients' point of view, this interaction can seem very complex and difficult to take in, especially at a time when they're not at their best physically or mentally. So it's doubly important to check that any communication has been understood.
All right. So, in simpler terms,
what's the answer? Is it answer option A, B, or C? So do I need to repeat it once again? Okay, I'll do it once again.
now let's hear the audio script.
So first, let's start by looking at a typical hospital admission for an inpatient, and the first communication they have about any procedures they are to undergo. On arrival, a patient will complete necessary paperwork. Various staff will talk to them about their treatment during their stay, which is designed to reduce patient anxiety. However, from some patients' point of view, this interaction can seem very complex and difficult to take in, especially at a time when they're not at their best physically or mentally. So it's doubly important to check that any communication has been understood.
All right. So,
Okay, so this is where keyword analyzing of the question is very, very important. I'll give you 5 more seconds to mark the right answer. As I told you, really need focus. You need high clarity on what to listen to. Not only the answer options, the questions. You must give every word in the question importance. All right, so good. Now let's come to the question over here. So what is this question? So this is a main point type of question. So one point, one key information is being highlighted over here. Okay, so let's see what the question is telling us. What point does Dr. Gardiner make about a typical admission to hospital? Now, typical basically means what? Usual, common. Okay, so common or usual, or we can say general. Okay, so typical basically means these are the synonyms for typical over here. Now he is saying generally when a patient becomes admitted. Okay, typical admission basically means what? The very first time the patient is coming to the hospital as a patient. Okay, admission. Okay, they are not talking about discharge, they are not talking about the treatment. So when a patient is coming to the hospital, okay, usually when a patient decides to become admitted to a hospital, okay, regarding a typical admission, this person over here is giving one specific key information. So what main point does he express about a typical admission to the hospital? Right. So now you have to understand, okay, when a patient, so according to this person, when a typical admission happens, what does he have to say about this particular thing? Okay, so let's talk about what is answer option A. Let's see what are the keywords over here. So answer option A is telling the information can overwhelm the patients. Overwhelm. So what is the meaning of overwhelming? Means it is too much. Okay, so if I give you too much homework, if I'm giving you too much assignments, you will feel overwhelmed. Okay, so it can be negative, it can be positive. So for example, if you pass OET, you get grade A in all 4 exams, and at the same time you win a lottery, and at the same time you see your long best friend, too much of positive informations, right? You passed OET, you won a lottery, and you're seeing a very special person. So too much of happiness also, you're going to feel overwhelmed. Okay, you're going to feel overwhelmed with joy. So overwhelmed basically means too much. So it can be negative, it can be positive, right? So here he is telling when a person is coming to get admitted to the hospital, the information given, so the staff is giving information. So all this information is just too much for the patients. Okay, it is just too much for the patients. That is what answer option A is telling. Now, what is answer option B? B is telling patients often feel unable to communicate effectively. Unable. See, for example, if I break your hands and legs, if I break your legs, will you be able to walk? Even though you want to walk, you will not be able to walk because you're unable to walk, right? So similarly, if I'm taking a sellotape and if I'm covering your mouth with a sellotape, will you be able to speak? No. So here they're telling the patients, they want to communicate. Okay, they have a desire to communicate, but they are not able to. Okay, they want to communicate effectively, but for some reason they are not able to communicate. So they want to communicate, but they cannot. They feel unable. So that is what answer option B is telling us. They feel unable to communicate effectively. Right. Now let's talk about answer option C. C is telling filling in detailed paperwork can be stressful for patients. Now he is telling it is stressful. Okay, when a patient is coming to get admitted, okay, we are getting, so patient is coming with a heart attack, the patient is coming with a leg injury, with fractures, and instead of treating the patient, we are giving them paperwork. You do one thing, you fill this paperwork, and then we will treat you. So all that paperwork task is too much stressful for the patients. Right, that is what this person is saying. Now, once again, let's do the verb analysis, because as I told you, see, in the previous question, okay, in this question over here, the elimination strategy really helped you, right? Just so you eliminated C and you eliminated A. So even before, so it was very much easy for us to choose the right answer. So here also, the elimination strategy is what we want. So for that, what do we need? We need the verb analysis. Right, you should perfect your verb analysis. So what are the actions in answer option A? The information given can overwhelm the patients over here. So what is the main verb over here? Patients are feeling overwhelmed. So when a typical admission happens, the person is saying that he feels overwhelmed over here. Right. Now, when it comes to answer option B, okay, what is the action over here? Patients often feel unable to communicate. So what is the action over here? Feeling unable to communicate. That is, they want to communicate. However, they are not able to. For some reason, when the people come for admission, they are not able to communicate. Now, what about answer option C? What is the verb in answer option C? Filling in detailed paperwork can be stressful for patients. So here's the link, filling in data work. Okay, filling in paperwork. So this is the action over here. This is the verb over here. And again, stressful, that's the keyword over here. And this is what is very stressful for the patient. So answer option A, B, and C. So now you have to understand that this is how you comprehend the data. Right, you have to have comprehend the data, and you should know what the question stem is. So what is the question stem over here? The question stem is basically to understand what is the key information that Dr. Gartner is expressing about a usual, general, typical admission to the hospital. Like this, you really have to identify the stem of the question, and now you have to retention, right? You have to retain all this information to your memory, and now you have to bring in the elimination strategy in order to do step number 3, that is detection, comprehension, retention, and detection. Right. Now let's take a look into the audio script, right? So let's take a look into the audio script over here. So we listen to the audio twice. So okay, so memory of the question, right? So what's the question over here? Typical admission. So again, signal words. So in today's session, okay, there is always going to be some signal words. Okay, so you must know what those signal words are, because the OET will always 99% of the time they will give you a signal that this is when the answer is going to come. So if you're so alert on identifying the signal, it becomes much more easier, right? So let's take a look into the question. So here he is saying, so first let's start by looking at a typical hospital admission. Okay, so they're talking about the question, a typical hospital admission for an inpatient. And the first communication they have about any procedures they are to undergo. So he's saying, let's talk about a typical hospital admission for an inpatient patient. And the first communication they have about any procedures they are about to undergo. On arrival, now see, on arrival basically means what? They are just entering the hospital. On arrival, that means hospital, they are just getting into the hospital. Okay, so again, that is a signal. Okay, it is a signal. Okay, so regarding a typical hospital admission on arrival, so now they're telling, okay, the person is telling over here. Now she's saying, on arrival, a patient will complete necessary paperwork. Okay, now where did we read about paperwork? We read about paperwork in answer option C. Okay, filling in detailed paperwork. Now where is your eyesight going to be? The eyesight is going, your eyesight should directly come to answer option C first. Now what is answer option C telling? Filling in detailed paperwork can be stressful for patients. Now this is mentioned. Okay, filling in detailed paperwork. So this is mentioned, but you also have to wait for this person, for this portion, that is, this is stressful for the patient. Only if this is mentioned, we can choose answer option C. Now this is partially mentioned, right? So let's see whether that is mentioned or not. So the person is saying over here, on arrival, a patient will complete necessary paperwork. That's the only thing they have mentioned. So they have not yet mentioned about anything stressful over there. Okay, so we cannot choose answer option C as of now. So let's keep reading the audio script over here. Now he's saying various staff, different staffs will come and they will talk to them. Who's them over here? The patients. Okay, so you must understand what these pronouns are referring to, right? So them over here basically means patients. So various staffs will come and they will talk to the patients about their treatment during their stay, which is designed to reduce patient anxiety. Now, what is the intention? So what is happening here? The staff will come and they will talk to the patients. Okay, what are they going to talk about? About their treatment. Okay, what is going to happen during their stay in the hospital? Now, what is the intention for this activity? The intention over here is to reduce patient anxiety. This is the intention. Okay, this particular activity was designed to reduce patient anxiety. Okay, now over here, let's see whether that is indeed the case. However, now see, those who attended in yesterday's class, I talked about contrast marker, right? So again, this is extremely important. So what did we talk about in yesterday's class? We talked about a contrast marker. Contrast marker basically means what? It signals a sudden change in idea or tone. Okay, when there is a sudden change in idea or tone, there will be a contrast marker. Now, however, that is a contrast marker, right? Now, see over here, what is this portion of the sentence telling, which has been designed to reduce patient anxiety. So this is a positive information. Okay, designed to reduce positive information, to reduce patient anxiety. That is a positive information. Okay, we are doing a very good thing. And what is our intention over here? To reduce patient anxiety. Now, they are giving a contrast marker. So when they're giving a contrast marker, that is, however, we can say that a sudden change in idea is going to come. Now the person is saying, however, that's a contrast marker. From some patient's point of view, this interaction can seem very complex and difficult to take in. Now, what is the person saying over here? The person is saying the exact opposite. Now, you see, from positive information to a very negative information is coming over here. And what is the negative information over here? Okay, for some patients, according to patient's point of view, okay, this interaction. So when a patient is coming, again, it is on arrival. The patient is just arriving into the hospital and the medical staff is going to the patient and the medical staff is talking to them to reduce their patient anxiety. But the opposite is happening. Okay, however, see, contrast marker. So a sudden change is happening. However, for some patients, this interaction can seem very complex and difficult to take in. So what is that information? That is a negative information. Right. See, even before we listen to this portion, when you hear this word, okay, when you hear this word over here, you should be able to say that a negative information is going to come because that's a contrast mark over here. Right. Now, where is your eyesight going to be? Your eyesight is going to be in answer option A. Okay, so the information given, so they are giving information, right? The staff is giving information, and this can overwhelm the patients. Can basically means what? It has a possibility. Will basically means what? Will basically means 100% of the patients. The information given will overcome. So will basically means all patients. Okay, all patients basically means will. Can means what? It is a possibility. It is possible. It is possible. It can make them overwhelmed, or it may not make them overwhelmed. So it is just a can basically means a possibility. Right. So now your eyesight is an answer option A. Now is the verb mentioned over here? The information given can overwhelm patients. So it is mentioned. Right. It is basically mentioned over here. So we can say that answer option A could be the right answer. And this is completely eliminated. That is, filling in detailed paperwork can be stressful. Now, why is this important eliminated? Because this keyword is not mentioned. All these things are mentioned. Filling in the paper detail. So this is mentioned over here, but it is stressful for patients. That is not mentioned. So since that is not mentioned, very easily we can eliminate answer option C. Right. Now answer option A is where we are in, and we suspect that it could be the right answer because the information given can possibly overwhelm the patients, right? So overwhelm basically means what? It is too much for the patients. So it is very complex. It is very difficult to take in. Now see, now he is reinforcing the idea. Okay, now see, when I'm talking about a main message, so remember when I told you, when a person is having a main message to say, okay, they will always emphasize, okay, they will put more stress, okay, and they will also tend to bring in repetition because it is a very important message to them. Okay, it is a main message over there. They will not say it just once or twice. Okay, they'll not just simply casually say it. Now you see, here they are repeating it once. Okay, it is very complex and difficult to take in. Now they are reinforcing, that is, now they're bringing, the speaker over here is emphasizing the same message. Now see over here, especially at a time when they are not at their best physically or mentally. So see, when a patient is arriving into the hospital, okay, when a patient is arriving into the hospital, they are not physically fit, they are not mentally fit, right? And at that time, when a staff is going and when the staff is talking to them, it, even though they're trying to reduce anxiety for patients because they are not physically and mentally sick, they are finding it extremely difficult to understand. That is, it is too overwhelming for them. Now see, he is emphasizing. Now see this entire portion over here. This entire portion over here is right. Now see, once again, now the third repetition is coming. So it is doubly important to check that any communication has been understood. So now he is once again emphasizing, okay, that is not, okay, he's saying, therefore communication when we're giving, it needs to be made sure that it is easily understood for the person. Right. Now, let's come to answer option B. What is answer option B over here? Answer option B is this: patients often feel unable to communicate effectively. Right. So this is not actually mentioned clearly. They are telling patients are physically sick, they are mentally sick. Okay, so they are just coming over here. So it is difficult for them to understand the message, but they are not telling patients want to communicate, but even though they want to communicate, for some reason they are not able to communicate. That is not mentioned. They are telling patients feel to unable to take the information given. This is what is mentioned. Patients often feel, because they are mentally sick, because they are physically sick, patients often feel unable to take the information that has been given to them because it is too overwhelming for them. Okay, so since answer option B is not clearly mentioned, that is, it is maybe partially mentioned, most of you chose answer option B, but unable to communicate is not mentioned anywhere. So we cannot choose answer option B. You should be able to eliminate B option, and we have eliminated C option. So by default, what happens? Answer option A becomes the right answer. And to confirm, we can say all these things, information given can overwhelm the patient that is mentioned. And this is the main point he's trying to say. And so I'm going to play the audio once again. So this time, make sure that you're listening to emphasis. So the person over here, he is going to emphasis on this particular portion. That is the A option over here. It will be emphasized by the speaker. Okay, there will be a lot more stress. There will be more stress given to that one particular portion, and there will be a repetition. Because why? Because this is not a casual information. This is not a casual information. It's a very important information Dr. Barner is saying about patients. Typical hospital admission. Now, when you're going to listen to the audio, listen for signal words. Okay, you should be able to listen for signal words. And when you listen to a signal word, you must become highly alert. Right. So I'll just take a look into this document that I have prepared, and then we'll listen to the audio. So what type of question is this? So this question over here, it is a main point or a viewpoint type question. Okay, so this question over here is asking. So it is asking you, what is the key idea or opinion the speaker is trying to express? So there will be emphasis, there will be repetition, there will be more stress. So in this case, the question wants to know what is Dr. Gardner's main point about hospital admissions? That is, upon entry, what usually happens. So how can you mentally prepare for yourself for such exams on the examination day? Again, comprehension of the question. Read the questions thoroughly, understand the question step, and prepare yourself. Okay, so you should underline words like what point. So these are the key words. You have to underline them on your examination day. Typical admission to hospitals. Then you should be able to anticipate for signal words. Predict. So expect. So you must expect the speaker to describe a process. Like, see, what is the process over here? Hospital admission, right? So over here, like what happens when a patient is admitted? And then once that process is done, then they will share their opinion. Okay, then they will say what usually happens. Okay, so here the person is saying patients are mentally sick, physically sick, and they cannot take in the information that has been given. Listen for attitude words or contrasting ideas. So here also that contrast marker, right? What I discussed in yesterday's class, that was very much important over here. So these actually, reveal the speaker's main point. Okay, and then focus on the summary idea. Again, they will summarize the thing over here. So that also like towards the end. So usually if it's a main idea type question, the answer is usually towards the end of the audio section. Okay, so don't get words. Again, they will try to trick you and all. So don't get stuck on certain words and all. Paperwork, anxiety, again, those are distracting information. Right. So anyway, I'll share this document to you towards the end of the session. So there's a list of vocabulary over here. So synonyms, meanings, everything has been given to you. So you can make notes from it. Right. So now let's just listen to the questions audio once again, because this time you should be able to eliminate the incorrect answer options one by one.
Now let's hear the audio script.
So first, let's start by looking at a typical hospital admission for an inpatient, and the first communication they have about any procedures they are to undergo. On arrival, a patient will complete necessary paperwork. Various staff will talk to them about their treatment during their stay, which is designed to reduce patient anxiety. However, from some patients' point of view, this interaction can seem very complex and difficult to take in, especially at a time when they're not at their best physically or mentally. So it's doubly important to check that any communication has been understood.
All right.